What's up, you guys? Chris Frills here. I'm a sophomore here at Carleton College. I'm a psychology major and a varsity diver.
Hi, I'm Sarah Frey. I'm also a sophomore here at Carleton, psych major, and I am on the women's varsity soccer team.
Hey, my name is Michael Grinnell, and I'm a junior here at Carleton College, and I'm on the varsity men's basketball team.
Today we're going to be talking to you guys about athletic concussions. The history of the concussion is really valid in trying to understand the efforts behind prevention of a concussion. It was back in between 1869 and 1905 where there were recorded 18 deaths and 159 documented injuries with the sport football alone. That's kind of significant because if you think about it, there's multiple sports going on multiple campuses in this day, which makes it more susceptible to more injuries at any given time. The attention was brought to this by the then President Theodore Roosevelt. You can see the progression in the realm of athletic concussions because in 1862 there was the Committee of American Medical Association Committee on Medical Aspects in Sports organized a conference addressing the head protection and also other sports associated medicines. With this progression, there became a more defined and concrete definition of what a concussion is. Concussions are defined as a trauma-induced alteration in mental status that may or may not involve loss of consciousness. It is the literal shifting of the brain inside the head. So common misconceptions, and one of the most common misconceptions, is that when a person has a concussion, they're presumed to be blacked out. However, it's not so much true. 90% of athletes are rendered unconscious who actually do have a concussion. So now that we understand or have an understanding of what the history is, or the background is of a concussion, I want to talk more about what the causes are. Sarah?
Thank you, Chris. As Chris said, I will be talking about the causes of concussions. There are three main types of concussions that one usually gets. It is either an acceleration to the body or a drastic deceleration of the body or a rotational acceleration. And rotational accelerations are usually found mostly with boxing, like getting hit in the side of the face and your head seems to spin. With sports though, there are a couple major positions that find themselves often getting concussions, and specifically quarterbacks, wide receivers, defensive secondaries. These groups of people in football usually get concussions from a face mask impact at an oblique angle, and hockey players are also a common group of people or athletes that get concussions as well, and they usually get it from a drastic blow to the head, jaw, or chin by another player or the puck or a hockey stick. So these three main types, rotational, acceleration, deceleration impacts, are the main causes that cause concussions to occur in athletes and in everyday people. So now that we know these types of causes for athletes, we need to discuss the symptoms and diagnosis for concussions, and Michael will be discussing those.
Thanks, Sarah. As I mentioned earlier, it's extremely important to differentiate between the prolonged effects of concussions and the immediate onset of concussions. The immediacy symptoms that one might experience are more physical, and they range from one experiencing blurred vision or not being able to remember what happened right before or after the injury. They also might slur their speech, not be able to concentrate right away, or not remember what the date is. They also might have extreme sensitivity to light and experience the feeling of nauseousness or throwing up, and they might actually have double vision, or they might be unable to stand or walk properly, while the long-term symptoms are more behavioral and emotional, and these include a person experiencing the feeling of crankiness, or they might lose an interest in a particular activity or interest that was particularly important to them. They might display emotion that's inappropriate to particular situations. they'll experience extreme fatigue, and they'll have an extreme inability to concentrate, whether in the workplace or in the school environment, and their scalp might swell up. And in children, they'll experience lethargy, restlessness, and irritability.
And now we're going to talk a little bit about the physiology that goes into a concussion. A concussion is a complex physiological process induced by a bump, blow, jolt to the head or body, transmitting a force causing the brain to literally twist about inside the skull. The damage that's done to the brain is on a microscopic level. In the brain, there are cells and cell membranes, and these cell membranes are stretched and torn. This leads to an abnormal amount of movement from calcium, potassium, and glutamate, and of course other substances inside the brain. These changes disrupt the normal function of cells in the injured part of the brain. While this is happening, at the same time there's a chemical change that is happening as well. The brain restricts blood flow to damaged areas. Blood is the only source of fuel, or what we know as a glucose, for the brain. This is a problem because as the injured brain cells now have a limited supply of fuel, but an increased demand for fuel as they attempt to repair themselves. This mismatch in fuel supply and fuel demand leads to further cell injury and dysfunction. Now that we understand what the physiology that goes into a concussion, we're going to hear a little bit more about the testing for a concussion. Sarah?
Thank you, Chris. With concussions becoming more and more common in the athletic community, there have been multiple testing methods that have been implemented to determine the severity of a concussion and also determine if and when a player can come back into their sport. Baseline testing has been used especially in the college athletic community to determine if and when a player can come back. These baseline testing, there are multiple different types, but they are generally looking to get like a general standard for the player's reflexes, cognition skills, motor skills, and perception skills, so that these things can be measured against a concussed player if they get concussed. So what this means, in other words, is if a player gets a concussion, they use these baseline scores to determine if the player is back at the level they were before they got a concussion. And if they are, they can play. If they're not quite yet. There are also neural imaging testing used to determine the severity or if the player is concussed. So these include MRIs, fMRIs, and CT scans as well as others. But those are the major ones. These testing methods have been used to further the safety of athletes who have been concussed, to prevent any concussions from happening, or to determine if they're safe to go back and play. Now Michael will talk about care and treatment of a concussed player.
Thanks, Sarah. Now, after someone has experienced a concussion, there are a few things they can do to help the recovery. First of all, getting plenty of fluids can be extremely beneficial, and also bed rest is crucial. Depending on the type of concussion, whether it was a mild concussion, they can take Tylenol or Advil to help some of the pain go away. Also, an ice pack can be applied to help relieve some of the swelling and the pain. There are quite a few long-term effects that are induced by concussions, specifically ones that affect performance rate and general motor skills. Some of the long-term effects include changes in one's ability to sleep, ability to think or concentrate in work or school, remember certain incidences from their past, and they might have changes in their personality or changes in their sex drive, and experience metabolic dysfunction and a lower verbal memory. Also, they might experience some cognitive deficits, and after they experience one concussion, they're 3 times more susceptible to getting another one.
Performance and motor skills are crucial to an athlete's career. However, it is unfortunate that once one suffers from a concussion, they're never able to fully regain the performance that they once had. There's a diminished ability to reproduce an action that one has just seen. For example, if someone were to demonstrate an action to an athlete and ask them to repeat it, the athlete would have trouble repeating that same action that they just saw. There's a lack of consistency as well in the sport. If an athlete was an extraordinary player, it's hard for them to be consistent, to be a consistently extraordinary player in that sport. There's a diminished athletic prowess. Once one suffers from a concussion, there's a possibility that there's a fear that's enabled in them to not be able to repeat or perform at the same level that they were when they received the concussion. And those are just the cognitive symptoms. There's also the physical symptoms, for example, things of like fatigue and headaches.
Sarah will talk about some of the prevention methods.
We kind of want to conclude this discussion on athletic concussions with prevention methods that have been discussed in the athletic community and in concussion research. The first is wearing a helmet. It sadly isn't as simple as just putting it on. You need to make sure it fits correctly, it isn't too far forward, too far back, you have a chin strap to make sure that it is doing its proper job. The second is hydration. If you stay hydrated, there's a correlation that you're less likely to get a concussion than if you are dehydrated. The last kind of silly prevention method is coaches need to stop teaching their athletes to use their head as a weapon. So football players need to stop going into tackles head first. Hockey players need to stop checking players head first. Making this simple adjustment in a player's game can really lower their risk of getting a concussion. In conclusion, Michael, Chris, and I have talked about in depth the topic of concussions with athletes. Some of these topic and themes that have come up in research have been background, symptoms, long-term and short-term, prevention, treatment, physiology, and prevention, just to name a few. However, there is still a great need for more research on prevention methods because, as I said before, there is no real cure. So there still needs to be more research done in that area of athletic concussions in hopes that eventually there is a way to completely stop this epidemic.